India has 22.7 lakh people living with HIV/AIDS as per National AIDS Control Organization NACO Statistics 2009. The need of the hour is to instill hope and courage in the hearts of the people and to create experts who could help prevent, care, support and treat people living with HIV/AIDS. Welcome to the Government Hospital of Thoracic Medicine, India's largest AIDS care center that willingly strives to provide stigma-free care, support, treatment and hope to hundreds of HIV patients from all over India. Set on the verdant foothill of Pachamalai, the GHTM, then called the TB Sanatorium, came into existence on 9th of April 1928 as a 12-bedded facility to treat and care for people suffering from tuberculosis. The government took over in 1935 and the bed strength rose to 776 in 1976. In 1986, it was rechristened as the Government Hospital of Thoracic Medicine. The most notable conversion of the hospital to the HIV Care and Training Center was found to happen in 1993 with the admission of 2 HIV with tuberculosis patients. Gradually, their number grew and it became essential to train the medical officers, paramedical workers and supporting staff in HIV disease diagnosis, care and management at Tambaram. The medical officers and other staff overcame their hesitation and fear and began to develop an interest in HIV disease. Today, an estimated 300 HIV patients receive outpatient services and more than 300 patients receive inpatient treatment in 8 dedicated HIV wards daily.
From the beginning, when we have ITCD center, diagnosis, treatment and diagnosis of opportunistic infection and also management of ART and its complications and also SASR. We have first case was admitted in this hospital. Almost nearly about 17 years we are dealing with the HIV patients, so gradually stigma is going down.
The need for improved infrastructure and training to build the capacity of the GHTM faculty and to strengthen it as a center of excellence led to the historic public-private partnership between the Government of Tamil Nadu and the Centers of Disease Control (CDC) in 2002. CDC built a state-of-the-art laboratory and ART center as well as a training center and invited the then International Training and Education Center on HIV, ITEC, a project of the University of Washington, Seattle and the University of California, San Francisco to provide technical assistance to GHTM in training and human capacity development. ITEC is now called the International Training and Education Center for Health.
A foreign university to come and help in this one. So I will give mostly that credit to the Tamil Nadu government. That the government of Tamil Nadu invited, government of Tamil Nadu put that platform, government of Tamil Nadu took it forward.
A one-year HIV clinical and leadership fellowship program is being run at GHTM with technical assistance from ITEC and support from CDC, TANSACS and DME, wherein up to 18 clinicians undergo rigorous clinical, public health, research, management and leadership training. The fellows attend to patients in the GHTM wards and outpatient departments during the morning hours, thereby providing additional manpower to the hospital, wherein they are mentored by the GHTM and ITEC faculty. They attend interactive, case-based didactic sessions on various topics conducted by internal and external faculty in the afternoon.
It's a very good public-private partnership between the Tamil Nadu state government, the Tamram Hospital and iTech.
GHTM showed immense interest in getting technical assistance from iTech towards developing curriculum for training physicians and specialists to producing academic videos and various IEC materials. Each physician at GHTM is empowered with knowledge on latest HIV/AIDS care and treatment systems and training methods, which in turn serves to strengthen GHTM as a whole. iTech has developed a standard procedures of HIV/AIDS care handbook, popularly known as Blue Book, which serves as a ready reckoner on the NACO guidelines on treatment of HIV/AIDS in India. iTech has also developed a 10-case opportunistic infections teaching resource for medical educators in collaboration with the GHTM faculty. iTech supports research activities of the GHTM in many ways. The Institutional Review Board (IRB) of GHTM is headed by the Medical Director of iTech, and several research proposals of the fellows, clinicians and postgraduate students are screened and approved here. iTech is also a part of the research committee, which has been recently set up to strengthen the research activities using the vast and varied database of patients. The fellows are guided by iTech to do short research projects as part of the fellowship program. So far, 48 research projects have been completed and a compilation of abstracts has been developed to be shared with NACO, CDC and other organizations. The TB/HIV Information System (THIS) is a one-of-its-kind electronic management information system at GHTM. This state-of-the-art system mainly focuses on improving the efficiency and effectiveness of care given to patients and routinely provides complex and rare data to influence policies in the country. iTech has been providing technical assistance in running and managing the database. It also trains the data entry operators and researchers at GHTM in utilizing and accessing the data through data analysis and technical writing. GHTM has utilized the resourceful strategies of iTech to strengthen health systems and improve quality of care to its HIV patients. Under the guidance of iTech, regular clinical society meetings for doctors and nurses are conducted. iTech is also a part of GHTM's State AIDS Clinical Expert Panel, wherein treatment failure cases are screened and recommended for second-line and alternate first-line ART based on national guidelines. GHTM hosts specialized training for HIV specialists, ART centers, Link ART Center and Community Care Center medical officers by using the curriculum developed by iTech for training medical officers and specialists in HIV care and management. GHTM gets logistical support and utilizes the iTech faculty as resource persons in conducting these trainings. GHTM now hosts the Warm Line, a mobile phone line devoted to expert contemporary clinical consultation on HIV care and treatment. Launched by iTech in 2008, this service provides expert consultation and clinical mentoring to the ART medical officers in the state. iTech has now transitioned this facility to GHTM and supports by providing quality assurance and monitoring support. GHTM physicians participate in a bi-monthly webcast from the University of Washington on current and advanced aspects of HIV. This helps as a continuing medical education and provides exposure to treatment methodologies and case studies from all over the world. Recently, ITEC has launched a national distance learning seminar series. GHTM faculty have been invited to participate as resource faculty to share their rich clinical experience in training other clinicians all over the country. GHTM has been enthusiastically participating in the support of nursing activities initiated by ITEC. A group of nurse master trainers were identified to build nursing capacities and demonstrate excellence in patient care. Nurses at GHTM have been trained to become effective trainers in HIV care. GHTM nurses were encouraged by the management of the hospital in getting trained by ITEC on basics of HIV care and computer operations. ITEC has been constantly involved in empowering the trained nurses in conducting the trainings and Nurses Clinical Society meetings on their own. Nurses at GHTM are the first in India to develop a unique curriculum for infection control. The Nurses Infection Control and Education NICE training packages are designed to educate nurses in biomedical waste management, infection control, and empower them to increase safety by implementing standard precautions. The GHTM nurses have also been facilitated to make a presentation in the International HIV Conference in Chennai.
Through ITEC மூலமா இது வந்து எங்களுக்கு கிடைச்சது ரொம்ப சந்தோஷமா இருக்கு. நிறைய யூட்டிலைஸ் எங்களுக்கு இந்த டிசீஸ் பத்தி கேஸ் பிரசன்டேஷன் ட்ரெய்னிங் பேஷண்ட்ஸ் கிட்ட நம்ம எப்படி ஹேண்டில் பண்ண நம்மள எப்படி சேஃபா பாதுகாக்கணும்ன்றது வந்து through ITEC மூலமா நாங்க ட்ரெய்னிங் மூலமா நிறைய லேர்ன் பண்ணிட்டோம். இது மூலமா இங்க வந்து நான் இந்த அளவுக்கு இம்ப்ரூவ் ஆகி ஒரு TOT ட்ரெய்னர்ஸ் ஆயிரு இந்த அளவுக்கு நான் யூஸ்ஃபுல்லா இருக்கேன் through ITEC தான். I have to thank so much to ITEC.
One of the important requirements for a center of excellence is the availability of reference materials and a well-stocked library. Recognizing the need to create sufficient reference materials on HIV, ITEC has helped GHTM to launch a HIV e-library, the first of its kind in India. This e-library is linked to the website of the hospital and has links to several reputed journals and websites that provide latest updates on HIV care, treatment and support. ITEC has not only been providing technical assistance in curriculum development, training, research and other clinical activities, but has also been providing support in infection control, administration and logistics of trainings, and also supervision and maintenance of its training center. The ITEC GHTM partnership has been a trendsetter in public-private partnerships, focused in providing clinical mentoring, human capacity development and health systems strengthening.
I think Tamil Nadu has the maximum number of ART centers today, and this is being one of the centers of excellence. More than 6,000 people, I think they are getting 6,000, 7,000 people are getting ART. That's the largest center probably in the country, probably even in Asia. That's a big center.
NACO recognizes and appreciates ITEC's role in supporting GHTM to be a model center of excellence for other centers of excellence in India.